Hey everybody, it's Erik Torenberg, co-founder, partner of Village Global, a network-driven venture firm. And this is Venture Stories, a podcast covering topics relating to tech and business with world-leading experts. Hey everybody, welcome to another episode of Village Global's Venture Stories. I'm here today joined by two very special guests, Nikita Singareddy, investor at RRE Ventures, and Niko Skievaski, founder and president at Redox. Nikita, welcome to the podcast.
Thanks for having us.
Yeah, happy to be here.
So we're here to talk about healthcare and some of the newest regulations, but also more broadly on the space. Nikita, you recently wrote an article sort of summarizing what's so interesting about the latest new regulations. Mm-hmm. Why don't you unpack what you were trying to do in that piece?
Yeah, this is something I think a lot about as someone who invests in healthcare and already has a big healthcare portfolio, but there's a tremendous amount of inertia in healthcare, and I think it's more pronounced in healthcare than a number of other spaces. I think the close corollary is probably fintech and financial services, where you have these really large incumbent players, and also, in addition to that, deeply fragmented on the customer side. So that might look like SMBs for the fintech world, and just the sheer number of people or companies that need payment processing. And then in healthcare, it's just the sheer number of provider organizations, vendors, and everything in between. So when you want to innovate in healthcare, there needs to be a number of driving factors that really force it to happen. And we've seen it happen a couple of different times in healthcare, but I think really following regulations is an easy way to see this materialize. One good way I think of framing this is if you look at the high-tech bill in 2009, which was related to the American Recovery and Reinvestment Act, that was one of the first times that the government said you need to adopt and demonstrate meaningful use of EMRs and EHRs. And it's not like the EMR industry didn't exist before that. I mean, Epic was already one of the biggest players in the space, and so was Cerner, but there wasn't that forcing function from the government to have to do that. And it really solidified all healthcare institutions, not just the big health systems, but also that kind of tail end, smaller provider groups had to use EHRs as well. But you see this in, not just with electronic medical records. You see this happen over and over again with different acts. So some random examples and other ones to mention, the Fairness to Contact Lens Consumer Act in 2004. That really created 1-800-CONTACTS and Hubble. The Affordable Care Act, I think, is an obvious one. In 2010, you got the Bright Healths and the Oscars. The Invisalign patent expired, and so you got Candid and you got Smile Direct Club, and then you have these telemedicine reimbursements, and now the CMS interoperability rules, and a bunch of other things related to data exchange on the Medicare admission discharge transfer side, as well as social determinants of health and provider directory. And you can very clearly see the time frame in which these products need to be rolled out. So I use that as, let me follow where this train is going. And usually you can see these rules and regulations put out 3 or 4 years beforehand. There'll be requests for comments, et cetera. And if you're smart about following those requests, basically, I think you can do a pretty good job of tracking where the industry is going and investing in those tailwinds, those forced tailwinds.
What I think is interesting, if I could just add to that, is healthcare needed the government to push innovation. So before meaningful use, which was part of the bailout package and back in 2008, healthcare organizations weren't on their own adopting electronic health records. They were kind of cobbling together their own systems and trying to make it work. But just because of the broken nature and misaligned incentives within our healthcare ecosystem, there wasn't really an incentive for them to use technology to better themselves and become more efficient on their own. And what we saw was electronic health records really didn't cross the chasm. If you think of the traditional business school crossing the chasm, electronic health records were a highly bespoke, customized piece of software that costs tens of millions of dollars to implement, 2 years to implement with the health system. And at the end of the day, it didn't really actually, it was unclear if they actually provided efficiency gains for their users. And what the government did, they had outsized incentives to do so with the last recession going on. They put money behind the subsidies to implement these electronic health records for hospitals and for providers. And what that did was it actually pulled the technology across the chasm. So typically it takes a 10x improvement of technology for it to be kind of naturally by market forces pulled across the chasm. But what we saw instead was the government pulled it across. And because of that, I think we got almost premature adoption of technology that wasn't really ready for mainstream yet. For instance, we're talking 2008 here, really went to effect 2009 and the years beyond that. So we're about a decade in, and electronic health records, we're implementing things today that were never designed to talk to the cloud, or designed to work with the internet in modern age. So we, in some ways, by the government interfering in natural progression of technology adoption, we actually saw a technology that wasn't ready to be adopted by the masses. And I think that puts us into a lot of the position that we're in today with the kind of older school technology, server system sort of technology that's being used by healthcare organizations.
Totally. And so is there any sort of forward predicting here in terms of predicting where regulation is going to go and what precedents that might set or what opportunities that might create as a result? And Nikita, as a healthcare investor, can you look forward, or do you really have to look back or look in the present?
I think you have to be 2 to 3, even 4 years ahead, because if you're looking at regulations today, right, there are already companies that have been built in the space and likely companies that already have several rounds of funding. And those companies saw these really seemingly intractable problems, and decided, I'm going to go against the grain and build a business here. And it's not like Redox necessarily knew, or any of these, any companies that I think are really going to take off with these new rules like ribbon and patient ping, et cetera. It's not like they knew that there was going to be a rule, but there was a general sense, I think, that people knew something had to happen, and probably the government was going to be that push in order for there to be more efficiencies being generated in healthcare. So you can look back, I think, several years and see. And RRE hasn't been the best at this, and I think there's plenty of funds that haven't been the best at this, but I think that that's a guiding force for me. If you look back 3 years, they were already asking, CMS was already requesting people and requesting institutions, give us feedback on how we should be thinking about data exchange, give us feedback on how we should be thinking about value-based care, give us feedback on XYZ things. And you can use that as a guide, right? And you're not always going to be, hitting the nail on exactly what the ruling is going to be. You never really have a full idea of that, but you can have a general sense of the space. And I think some people have been exceptionally good at that. Even when you look at companies that started, like I've read about this, and I'm not entirely sure if it's true, but even if it's apocryphal, I heard that, some of the people that went and built the Invisalign related companies, a lot of them were consultants and people that were generally tracking these regulations and had a sense of what patent expirations were going to happen. So because they knew that, there was this idea you could build a big business in this space because it was a white space. And I think you can be really ahead of the curve as both a builder and an investor if you put in the work to track these things.
Totally. And so where do you think are the biggest disagreements in the space right now, Nikita, in terms of where things might lead, or what this could lead to in terms of investment opportunities, or in terms of how the field might shake out?
That's a good question. I mean, as with all things, I think these regulations can help, but you never know if you're actually backing the right company. You can only back, really great teams and solving really great problems, and hope that, you're catching the right whale based on the information that you're going off of. I think that there's a sense that some people are thinking that some of these technologies may be commoditized. Like, I think looking at the telemedicine reimbursement rules are a good sense of that. I think people are saying some of these larger, let's look at a teledoc or a doctor on demand, and then every single related telemedicine company that focuses on a specific specialty and all the tools that you might need to run those businesses. Some people are saying, these things, everyone's gonna have them, and maybe they're actually just going to be available via API, so you don't actually need to be connected to a business to do that, and that would decimate some of these businesses. But healthcare moves super slowly. Even if you have a rule change, I'm sure we're going to see people pushing out the deployment of a lot of these technologies. And even if you read the rules closely, they give a lot of wiggle room for exceptions and for you to demonstrate that I need 6 months longer or 12 months longer for these types of reasons. And if you know anything about CMS, I think they actually give a lot of leeway to a lot of organizations. So I'm not sure. When you say disagreements, I think that that's an interesting way of phrasing it, because disagreements to me is just a sense of what's your go-to-market strategy, what's your distribution, what's your product strategy. I think ultimately it comes down to that.
Well, I think if we could give some context for what's going on in healthcare right now, I think there's a confluence of a couple really big trends that are happening. The obvious elephant in the room is that we're in the middle of a pandemic, and what that's done to our healthcare organizations is still yet to be seen. The long-term effects of that. It's financially decimated many organizations where they were already running on super slim margins. Now they are running definitely in the red this year, and that might continue for a couple of years. And so their technology buying really went from kind of a differentiating activity to something that is now driven off of necessity. How do we actually continue to provide services that we couldn't provide before via virtual care, via remote patient monitoring or other remote diagnostic services? All these ways that they need to adapt to in-person care, because even if social distancing works and the swell of new COVID cases goes down, people still want to avoid hospitals because that's where the pandemic is. You want to stay away from those. And so there's a very real fear that health systems have around how do we actually keep the lights on and working right now. And so their technology adoption has shifted to accommodate that. And at the same time, we've alluded to it a few times, but there's these new data sharing rules that I think really opens up the landscape for new technologies to exist that didn't exist in the past. And Nikita just wrote that great article on it. So maybe you want to walk through kind of some of the what has changed in the landscape based on these new rules that were, I guess, the latest version announced in March.
Niko, totally. I think when you look at hospital margins, right, they went from not great to begin with, 8% to 2% less than that in COVID times. And the spend that was there was always relatively small, but it's shrunk. And now I feel from my conversations I've had with health system leaders, there are things that they were maybe thinking about spending money on where they will not be thinking about spending money on that until 2024 at best. And then other areas that are top of funnel revenue expanding, where they're thinking about how do I actually have efficiencies in my call centers and the front desk so I can have more time actually being spent on care and less money spent on those kind of front desk resources. How do I expand and get more potential patients into the funnel? How do I actually think about building a proper healthcare CRM that hasn't really existed meaningfully for a lot of these health provider practices or health systems? And as you were saying with remote patient monitoring, it's the same thing. And it's an expansion, a net new revenue opportunity. Alexi of Nomad Health has said before, and I think about this quote all the time, it relates to a lot of businesses, but particularly in healthcare. In healthcare, you can't really offer people savings. Like savings doesn't mean much. What does mean a lot is, can you actually show me that my revenue is going to be expanded versus savings?
Totally. And maybe zoom out just a little bit. Niko, why don't you give more context on what Redox does and why it's relevant to the conversation we're having here?
Yeah, absolutely. So I cut my teeth in healthcare working at Epic, one of the large electronic health records. So I ended up leaving Epic and kind of jumped out into the healthcare entrepreneurial ecosystem. And I just assumed that there would be a lot of activity in Madison, where Epic is located, because the same year I left Epic, there were 1,200 other people who left Epic, with your typical 10% of people leaving the company every year. So I looked around the healthcare technology ecosystem and really saw consultants and not many people actually creating companies. And so that drove a lot of the motivation behind Redox, because we started looking at, well, why aren't there more healthcare technology companies, and why aren't the ones that are out there actually getting to market and getting in the hands of users? One of the biggest barriers that we saw was that in order for you to actually take your product to market, a healthcare technology startup has to go through like 2 years of a sales cycle. They have to, convince 100 people at a healthcare organization to say yes. And if any one of those people says no, then the deal is done. And so that huge gauntlet was a massive barrier to entry for new technology and for innovative technology that should exist in the healthcare space, because we still literally have pagers and fax machines and clipboards use in healthcare. And it's like the only place I've ever seen a pager being used in my adult lifetime. So one of the biggest barriers to entry for these technologies is getting through IT and the challenges of interoperability with the existing technologies, electronic health records at those organizations. And so this is kind of, a lot of the context around why this new regulation, this new interoperability rule makes sense as well. But this was, 6 years ago now, and we saw this problem, we saw the writing on the wall. And so we started a company, a middle layer, to actually pull data out of health systems, to standardize it in the cloud, make it available over a consistent API, and give that to software developers who are building applications for these organizations. So that's what the company does. That's what we started. The first couple of years of that, we didn't make much money because we were trying to figure out the chicken or egg problem. And so, as Nikita mentioned, one of my side hustles was a book that I created called ICD-10 Illustrated, and I crowdsourced artists to create artworks based on ICD-10 codes, which are billing codes that doctors have to send to insurance companies to tell them, how people get injured. So if you imagine the 120,000 ways people couldn't get injured and the different codes associated with that, there were a lot of funny ones. And so we got artists to kind of pick the funniest ones, like burned due to water skis on fire or sucked into jet engine. I guess that's not that funny, but it's, it creates good illustrations. And so we made a book, and I ended up selling like 10,000 copies of that book as the country was moving from ICD version 9 to version 10. And that's kind of how I kept afloat while we were in the early startup days of Redox.
Let's pretend us three were starting a venture fund focused exclusively on healthcare. Before sort of getting into sort of specific sub verticals and saying what we think about it, Nikita, what do you think is the mistake that most VCs, or misconception that most VCs have on the category, whether they're specialists or whether they're generalists trying to weigh in? What do you think they don't either see clearly or don't appreciate as much as they should?
Healthcare is one of these industries where you have to have a Rolodex, and even having a Rolodex, doesn't mean you're necessarily going to be successful. Most of the people that we like to back at RRE, and I think folks that have generally had success in healthcare, and again, it doesn't mean that you're going to have success, but I think it's a very important piece of it is you've worked in healthcare before. People in healthcare tend to trust other people who've worked in healthcare. If you're an upstart and someone who's never really been in healthcare before, it's just that much harder, particularly when you think about who you're selling to. It's less of an issue if you're selling direct to consumer, I think, but if you have anything that will start touching clinical trials, payers, and health plans, pharmaceutical companies, like anything, you have to really have folks on your team that have done that before so that you know how to sell into and have access to these types of high-paying customers. So sometimes I think that can be a little bit overlooked because even when you go and listen to some of the biggest success stories, like let's say, take One Medical, for example, or even Glenn at Livongo. These folks had a tremendous amount of healthcare background. And even for them, it was not just a cakewalk for the companies to be successful. And then if you take these kinds of two outlier founders and companies, and then look at everybody else who's tried to build a healthcare company that has a healthcare background, and then you look at the folks who tried to build a healthcare company and have no healthcare background, to me, one of the most successful variables is that kind of having that material healthcare background and having folks on your team that have the background.
What you just said makes me pretty sad because what that means is, it's like the status quo. We're depending on the status quo to fix an industry that desperately needs disruption. But I think it's true. I'm a hypocrite here in that I came from Epic. Like I came from that world of understanding how healthcare technology works. And that's how we were able to kind of solve that chicken or egg problem and get through it. But, I'm not an investor, so I'm not putting my money where my mouth is. But a lot of the companies that I see that get investment that I kind of roll my eyes at are it's really easy to have a huge vision in healthcare about the way the world should work, because as an entrepreneur, you can see a million different ways that healthcare should use technology to be better. And so as a founder, you can paint this vision and say, like, this is how our tech should work, and this is how the world should conform around this vision. And the execution of that vision is a whole nother story. And I see a lot of companies with a very big vision, and they can't get past one or two customers. There's a lot of healthcare technology companies that have like one or two or three or four or five customers, but there's not a lot that have 20 or 30 or 50. And there's a big gap between those that do and don't. And it's often that the ones that succeed have a way, a foot in the door. They have whether that's connections, like Nikita was talking about, but more often I think it's a very specific value proposition that has a buyer that can say yes to that, that isn't too expensive, that they don't have to wait for the next budget cycle to figure out how to pay for, and they can start small and then kind of grow from there. And I think that those focused companies, we've seen them grow a lot faster And it's hard to do the whole land and expand thing in healthcare, where it's like, okay, we're starting in diabetes and now we're expanding to congestive heart failure and all the other places where there's a lot of good to be had. But I think starting focused is where we've seen a lot more companies be successful.
And Niko, something you said in that as well was you understood the challenge working at Epic. You deeply understood what the problems of data exchange were and what was going on, what was the issue with EHRs as Epic built them, but also as competitors, the Cerners, the Athenas, the et ceteras of the world. Yeah, Niko, one of the things you also just said was around deeply understanding the challenges of data exchange and interoperability as they relate to EMRs because you worked at Epic and because you had an understanding of this is what the competitors look like for Cerner, Athena, as well as all these like tail end EMRs like WebPT for physical therapy, et cetera. That is the same thing in healthcare and building a great healthcare company. As you were saying, you don't properly have a sense of the real challenges and why this thing doesn't work if you haven't seen in a very intimate way, this is how that aspect of healthcare, this is what it actually looks like. This is what it looks like if you're a social worker thinking about social determinants of health, so some social determinants of health company. Or if you haven't worked in IT, you don't have a sense of these are what middleware companies may look like or how you actually work with vendors. The same thing, anyone that's trying to sell into a payer or a health plan, having sat on the other side of that for myself at Oscar and in the intimacies of insurance operations and how it works and how internally within the company things get done and what we're prioritizing and not prioritizing, it is the same for any industry. I don't want to overstate that healthcare is super special in that way, but there is something quite unique to the way healthcare is still operating like it's the early 2000s.
Totally. There's some big firms who've chosen not to get into healthcare because maybe they just don't think it can have the type of big outcomes that big firms need. What do you see differently about the potential to be sort of, decacorn plus potential in healthcare companies that maybe some of these other firms are missing, and maybe that's why they don't enter them as often?
Did you say deck of corn? What does that mean?
Yeah. 10 billion plus.
Oh. Investor lingo.
Niko, don't worry. We'll bring it up at the next board meeting.
Great.
I think that there's there is a list of ideal buyers for any kind of healthcare company or any kind of company, right? That you're trying to sell your product into. And I think that there are certain spaces in healthcare that are just much, much harder than the others because of fragmentation or because of overconcentration. I think two easy binaries of this is trying to sell into provider groups of which there are tens of thousands, and then trying to sell into an insurance company of which there aren't really that many. I mean, most people know the big 5 health insurance companies. And so when you're thinking of how to sell, it's going to be a challenge if you're going through something that's super, super fragmented or an area that's really, really concentrated on the buyer side. So when it comes to thinking about investing in a healthcare company, you want to maximize efficiency and maximize speed and success, right? So when I think about, why we invested in a company like Redox, I think that really we're maximizing the amounts of sellers and like this kind of the intention of what a middleware could do to bring in a lot of people into an ecosystem makes it a much easier, I think, sell than something that's you're trying to sell to every single tens of thousands of provider groups. It's just more of a challenge. So I think that can be something that can be really hard for the average investor, particularly if you don't have a background in healthcare to get over. Also, healthcare is really confusing. I don't think I really knew what a copay or a deductible was before I worked at Oscar. And thank God it never came up in the interview because I probably would not have been able to answer that question. And that's the average person. And then, investors are, I'm not trying to say that they're not average or whatever, but you're not ever going to be an expert on every space. And I think that there are some spaces where it really requires you to be much more of an expert so you can get to the meat of the business. So I think healthcare is one of those spaces.
If I could add, and maybe this is too elementary, but if you look at healthcare and the industry at large, it's so inefficient and we spend so much money on it, nearing 20% of GDP, that something has to give. Like at what point and that number's been climbing, right? Every year it climbs up a little bit more. Like, at what point does that totally cripple our economy? Is it 25%? Is it 40%? Like, where does it break? And if you just look at that and say, something's got to give here. And then also, like, the consumer experience in healthcare is terrible. Like, as a patient, we know that there should be so much opportunity for improvement. And there are huge incumbents, and the status quo is strong, and there's a very complex system. So it's held off for so long, but something has got to give. And maybe what we're seeing right now, because I've been saying this same thing for years, but maybe what we're seeing right now with the pandemic is it giving, because we've taken this old crappy car and now we've floored it with this pandemic, and the wheels are falling off, and we need to replace it in a lot of ways. And so I'm really optimistic about new types of healthcare delivery models to start to take hold, especially as patients are now open to seeing doctors in different ways. They're not, gonna do the same old, like, drive across town, wait in a waiting room and see a doctor for 3 minutes, just to, go over a blood test, right? Like, there's so much opportunity to change that. And that's why I'm, like, extremely excited about where healthcare is going, and why, as an investor, I would be looking at what are the ways that that's going to unfold. And so that's at a really high level, obviously, but I just think there's got to be something there, and there's got to be what did you call it? Stacks of corn? I forgot already. There's got to be those opportunities here.
Yeah, I totally agree. And to talk about the consumer aspect, I think that's something I've been thinking a lot about, because some of the players I mentioned earlier, they have deep pockets. The average patient does not. And we know for that insurance, even if you have good, quote unquote, good insurance, doesn't work that well. And you can still get slammed with a bill that'll put you in some serious medical debt. If you look at some studies, I think InstaMed, which is owned by JP Morgan, it's a payments company focused on healthcare. They put out this really interesting stat that even in like 2007, patients/consumers were only paying for about 8% overall of their healthcare bills. Now it's up to 33%. Isn't that crazy? Of a space where if you already have insurance, or even people that don't have insurance, that's a lot. That's a high percentage and a lot of money to be spending. And so when I think about investing in companies in healthcare, and I think there's this big seduction around consumer digital health businesses. And that's why when you look at a lot of the best healthcare companies, they have multiple revenue streams and multiple types of buyers. Even a digital health company, oftentimes they'll be working with medical device companies, they'll be working with pharmaceutical companies as alternative streams of revenue, even some of these diagnostic companies that send, testing sticks to your home. They're also looking at alternative revenue streams. You never want to be too focused, right, in one area just in case it dries up. And in healthcare, I think there's a very good reason to be working with lots of different types of players. I never want the consumer who's already so buckled under a tremendous amount of financial pressures in many, many different directions to be spending even more than they should be in healthcare.
I think that consumerism point is a really good trend to touch on. Fundamentally in the healthcare market, one of the things that's really broken is consumers don't have a direct demand for healthcare. Like, you have a demand for any other sort of consumer products. In healthcare, we have a derived demand in that we want to be healthy, and we hope that buying healthcare will make us healthy. And because we don't have an understanding of how healthcare can provide health, we depend on experts to help facilitate that. And that's your doctors and healthcare systems and payers who are telling you to, get your annual checkup and all that sort of stuff. And so that is a fundamental market failure that prevents healthcare from operating like most markets, where a consumer can just, pay the 100% of the fee and actually rationally save and act as a consumer on their own. But what that means is that technology has an amazing role to play in fixing that market. So yeah, you could argue that the market should be replaced, and this is what a lot of industrial countries have done. Is instead of fixing their healthcare markets, they replaced it by a government run program that pays for everything, and has guidelines around what people should do from a behavior standpoint. But you could also look at the opportunity to fix the market by providing more transparency into that production function. How does healthcare translate into health? And that's where things like AI should have huge potential. That's where all the consumer heuristics and technologies that come from the consumer space, as they move into healthcare, I'm hoping that they are able to engage patients in figuring out how does their actual behavior change their long-term health. And as Nikita mentioned, as consumers pay a bigger and bigger portion of their healthcare, they actually have an aligned incentive to close that information gap and figure out, if I go and get an MRI down the street instead of at the academic medical center, is that going to be way cheaper? And, aligning those incentives around things that can actually drive costs down, I think is hopefully the American way to save our healthcare system. Otherwise, I think we will have to replace it, because the government-run systems are much more efficient in every regard as far as cost goes. There's other problems here and there, but from a cost perspective, the United States is off the chart. I don't want to get political or anything, so we don't have to go down that rabbit hole.
I'm not going to go down that rabbit. Or this would end up being like a 2 to 3 hour podcast. But I did like, some of the things you were mentioning about shoppability, and another just aspect of how I've been thinking about healthcare as an investor. You can bring some easy tooling that has existed in other areas and just bring it to healthcare. And it's not that revolutionary, but it could be huge. It's kind of interesting, right? Like, why is there no, make things HIPAA compliant? Let's just, construct that around everything I'm saying, lest the CMS gods come down on me. Why is there no Slack for healthcare? Why is there no Trello for healthcare? Why is there no, like Amazon really for certain types of durable medical equipment? I think we're now seeing companies in that space, but it's pretty crazy to me that you could take these existing business models, jigger them a little bit, and bring them to healthcare. And I think that they would actually see a tremendous amount of success. This goes to, I think, the challenge that Niko also brought up, where he said, we want to see, it's unfortunate that a lot of people that are successful when they start a healthcare startup are people who've been in the business for a long time. But it doesn't always have to be true. Like, I think that there are people who've built these other kinds of companies that have worked as developer productivity tools or just business applications that any business has, and just bring that to healthcare and take a mindset of empathy for all the people that are in the healthcare system, whether it's the patient and their family, it's a caregiver, it's a provider, it's someone in insurance operations, it's someone who's just on the phone. I think if you can do that, you can also unlock some really phenomenal billion-dollar opportunities. And it doesn't have to be something that is the biggest uphill battle in the world, because some of the constructs of the success of a business like this has existed in other places. Do you want to go off of, I think it'd be interesting to see from your perspective, you probably, Redox obviously has had a sense of this is what the rules were aiming for, but you didn't know what they were going to be until recently. Yeah. So, I've had a sense of this kind of over changes, but I'm curious, and you don't have to obviously go into the internal machinations of the Redox business, but as you were figuring out, okay, this is what we're building this business, having a general sense of not what the industry wants, but also like where we think that the regulations are going to end up. This is where the regulations are now. And where does Redox fit in relative to that?
Yeah. So right now, current state in healthcare, data is exchanged a ton every day. So data goes from software providers to the healthcare organizations and their electronic health records for providers to look at. And if you see a telehealth visit, data goes from the doctor you're seeing on telehealth to the pharmacy, and it goes through all these back-end networks. And they happen through agreements that are kind of done behind closed doors, and largely these are called business associate agreements, where two parties will say, "Hey, we are now business associates and taking care of this patient, and therefore we can share data with each other." The foundation of the new interoperability paradigm is that we are giving the right for that data to move based on where the patient wants it to move. So the patient has become the forefront of the foundation of these new rules. And what that means is that instead of data flowing between your doctor and your scheduling system that you can access on your phone as a patient to schedule your next appointment, instead of that happening behind closed doors, we want that all to come to the forefront. And it's almost kind of like a GDPR-esque move in that patients will have the right to see where their data goes, have the right to stop it, and all of that sort of stuff. And it's this groundwork is being laid, this infrastructure is being put out so that we can encourage more innovation to happen with healthcare data. And what I mean by that is that if a patient can say, I want my data to go to any application they want, then hopefully applications will exist that will serve, any sort of niche patient need that might be out there. From, the perfectly healthy young invincibles, like those of us on the call right now, like what sort of apps would we want with our health data versus the person who's dealing with, end of life palliative care? Like what sort of apps would they want built on top of their healthcare data? And the bet that the government is taking is saying that if we mandate that this infrastructure exists, that, we mandate a single API that healthcare providers and health IT companies have to contribute to in the exact same way, then this ecosystem of patient-facing applications should exist. And that's kind of the foundation of a lot of the new interoperability regulations. There's a whole bunch of details around that, but that's at the center of it. And I think that's what's fundamentally different here is that we're putting the power in patients' hands to hopefully drive a consumer like revolution around healthcare technology.
I thought that was a good summary.
One of the things that
I'll leave now.
The thing I find really interesting about this, so coming from the EHR world, electronic health records, there's almost this sense of net neutrality that comes along with the spirit of the regulation, in that. So at first, electronic health records, they are the application that doctors use. So when a doc is sitting there typing into the computer with his back turned to you, instead of paying attention to you in the exam, they're typing into an electronic health record. So they are the application layer, but the government mandated those EHRs to be in place, and therefore they've become the application layer. But they've also become the data source of truth for any healthcare organization. If you go to a healthcare organization and you ask them about their patients, like they're looking in their electronic health record system as their database for all of these patients. And what a lot of especially the information blocking rules state is that we actually have to have a separation between the application layer and the database layer. And what that means is that electronic health record system and EHR cannot discriminate against the type of applications that can be built on top of their database. And so that really calls for a decoupling of those two things. And it's difficult because, if you put yourself in the shoes of an electronic health record vendor, you kind of earned that position. And I know, like a lot of investors think about platforms, they earned the position to be the platform that has all the data, the source of truth, like Salesforce, for instance. Because of their market share, they earned the ability to have a marketplace on top of Salesforce with all sorts of applications. What the government is saying to electronic health records is, yeah, you earned that, but we also kind of gave it to you through subsidies. And therefore, now that you're in place, now that you have this unique position as controlling the pipes to the data, you have to make those pipes, have them open neutrally to any technology provider that's out there. Much like Comcast running a cable line to your house can't control, what shows come in clear, how fast your internet is for certain pages based on their own interests. It has to be a very neutral perspective and treat, everyone fairly built on top of that infrastructure. And so that's a really interesting position and a very controversial position that the government took, but really kind of going on the basis of that net neutrality presumption.
I really like that framing. I hadn't even fully conceptualized it that way, but it's really spot on. And it does still allow for, multiple sides that are interacting and using and leveraging this API network to also still have some kind of decision making about not just the kinds of information that they're giving, but there's still rules around. You're still given some independence to make certain decisions about it. For example, you are allowed to charge fees. It doesn't have to be uniform, but you can do that in certain ways, at least the way that I read through the regulations. There's also ways you can limit the amount of content that's given. There is a floor, so basics that you have to provide. But if they're pulling or requesting other additional types of information, you don't have to provide it as the entity. So I still think that it's trying to give some freedom and independence to and some kind of sovereignty, right, to these organizations. But in the same way that you pay for cable, the cable's not free. You still have to do that. But they're giving more uniform accessibility, as Niko really eloquently put it. And Niko, I now want to go back into my Substack post and put your quote in there about net neutrality because I thought it was spot on.
Well, I have to give credit where credit's due. That came from a description that Anish Chopra, who was the first CTO of the United States under Obama, how he described it, because he was instrumental during the actual net neutrality debate, and he's like, this is the same thing. It's, these organizations, because of cable companies, it's a natural monopoly in that it doesn't make sense for every cable company to have a cable line, going to every neighborhood. And same with EHRs. Like, when an EHR is implemented a health system, they're not going to take it out for 10 years. Like that's how long it's going to be there, just because of the organizational inertia and sunk costs that went into that investment. Like they're just not going to turn around and replace it. And therefore, that unique position of having a super sticky platform at these organizations gives it a unique market position where they can have anti-competitive behavior. And that's the basis for this regulation saying, we need to level the playing field to make it neutral. There's a fuzzy line, though, I think, between like what is EHR functionality versus what is like digital health functionality. Because, is a scheduling system, that's traditionally part of a practice management system. Is that part of an EHR? Or does the EHR have to let any scheduling system be built on top of their records and have a really open market for a provider or a hospital to, choose whatever scheduling system they want most based on their unique needs? And that's, I think that's an interesting play here, is that line in the sand was not defined by the regulations, saying, which digital technologies are fair game and which ones aren't. And maybe it's just all fair game. But if you think about it as an electronic health record company, they have all sorts of modules. They have population health modules. They have telehealth modules. They have, every specialty, dermatology, radiology, the list goes on and on. They have modules for those things. And a lot of the selling point for electronic health record systems is that all those modules work seamlessly together. And now the government is saying, well, heck, now you have to open it up for any dermatology application to work seamlessly with your underlying database system. And it really opens up the market for competition to more easily enter. Hopefully, that's the spirit of the regulations that have been put in place. We're starting to see the beginnings of how EHR vendors are implementing this. But, with the pandemic, a lot of the deadlines have been pushed back. So we're still, a couple of years out from it. But I think that's where a lot of the bets investors are making right now is, first, the infrastructure that will enable this to happen. So companies like Redox. But then secondly, if this infrastructure actually exists and is usable, there's going to be so many more companies out there that can take advantage of it and get to market faster. And, hopefully change the way that healthcare is delivered to become way more efficient, way more consumer oriented, and, just a better experience overall. And
that's what I think the exciting thing about being in healthcare in this moment is. I have not felt this excited about healthcare in a long time, because there were rules like, I guess the better way of putting it is lack of rules around this that really stymied a lot of innovation and just the ability to take something from 0 to 1, because you couldn't even do something as basic as integrating with Epic unless you're using Redox or something like that, without it being a actual meaningful, like you had to make that a part of your business. And right now, if you look at most companies that exist in the API world that are not related to Redox, that aren't or a data exchange platform, they aren't a core competency of a business. It's one of those things where you don't actually want to spend time doing this because it takes away from your time spent on your core value proposition. And now that you have this opening up, and hopefully, as Niko said, meaningful competition being enabled by these technologies that have to exist for everyone, we're going to see a heck of a lot of companies just be built. And that kind of manifestation in healthcare, they haven't seen that for a long time. And people now, I think, believe that they can build a company, and that's no longer a huge challenge.
Yeah, we see it really as the sort of continual abstraction of technical issues, much like back in the 90s, if you wanted to build a website, not that I was building websites in the 90s, but if you did, you'd have to literally have a server, under your desk running, and that's where your website was, right? And then we saw AWS and other cloud providers come about and really open it up and lower barriers to entry for new technologies. And nowadays, you don't even need to know HTML to build a website. It's all been abstracted away and made so much easier. And therefore, you can stand up an e-commerce site on Shopify in 10 minutes. And I think that's the direction that we're hopefully heading in healthcare technology, in that, 5 years ago, if you wanted to start a health tech company, you probably had to have 100 people on your team just to make yourself HIPAA compliant, to handle all the infrastructure requirements of integration, to have a huge enterprise sales team to go and knock on the doors of health systems. And like that's just to have a company and get your product to market. Hopefully in the future, it can be much more like other startups where it could be like 2 or 3 people building it out, and all of that complexity should be abstracted away.
So you've spent some time, a bunch of time in the EHR space. That space hasn't sort of gone as well as many investors have thought it would. Why don't you sort of give a little bit of historical overview for why that's been the case, if you accept that premise, and what are the learnings from sort of the last decade or more of VCs investing in EMR or EHR startups?
Yeah, certainly. And I think this touches on what I mentioned earlier about the government mandate. So yeah, the government created a market for EHRs, but what they did, it was very heavy-handed in all of the requirements that an EHR had to meet in order to actually satisfy that mandate and for their customers to receive subsidies for it. So that was the meaningful use requirements. And electronic health records, essentially, I think, from 2008 to now, they really lost their innovation muscle. And, they took 80% of their product and R&D resources and turned them towards meeting regulatory requirements instead of what most tech companies should be doing, which is listening to their customers, innovating, iterating, all of that sort of stuff. That kind of went away because everyone was focused on how do you actually meet the requirements provided by the government. And that was the last decade of EHRs. And so, yeah, it did make some kings in the space. And, we went from not that much EHR adoption to like 98% of the market is using an EHR now. So the government, I think, with those regulations kind of put EHRs in a tough spot to meet the needs of their customers, which is why you can't find a doctor who likes their EHR today. They all, speak terribly of them. And they call it, like Epic is the best of the worst. So I think that was a tough spot to be in. And nowadays, because of the regulation that's surrounding electronic health records, you definitely don't want to start a new EHR company. Like, I don't think you can start disrupt Epic and Cerner. Like, you don't want to start that business because it would take years to meet the regulatory requirements. And then because of how sticky they are once they're implemented, health systems aren't going to turn over and buy a new one. So I think the new approach is going to be that EHRs over time will be kind of relegated into the database, and they're going to compete on the application layer, of course, but they're going to compete with a whole market of people building apps, assuming that the database is the EHR, and hopefully there's a middle layer in between that can connect them. And that's, this government mandated FHIR-based middle layer. That's kind of how I'm thinking about the technology market. But, you don't see startup EHRs. I think Dr. Chrono was probably like the last one that came and made a splash, but they're really selling to the edges of the market, to private practices and small practices and specialties that didn't need to adopt EHRs to begin with.
Yeah, I think Niko's right about that. I don't want to say I don't want to see any new EHR business being built, because I'd like to. I think that, I'd like there to be some. But you're right. Trying to unseat Epic, Cerner, some of these companies that have 50% collectively, 50 to 60% of the market is really hard. And just you would be shocked how big, like hundreds of millions of dollars, these longer health system contracts are with EMR companies. It's insane. And when you think about, as Niko was saying, just the sheer amount of time that it takes to train thousands of people that work in an organization to know how to use an EHR, it's going to be a really hard sell for a larger health system. But I think that there's opportunity, and I think this is why Dr. Chrono went after this kind of tail end. For really specialty EMRs, we see this in, I think, the dental world. Like, there's a company called Dendrite that has a substantial amount of the dentist EMR market. You have WebPT that has a lot of the physical therapy market. I do think that there's opportunity still there because it's much easier to sell to a small provider group, particularly certain specialties. Like, they really stick together. Like the physical therapist world, they're just buddies with each other. And it's, from what I've heard, a much easier to sell to a kind of specialty group like that. So I think that there is maybe opportunity there, but I would like it, as Niko said, to get relegated to more of a kind of a deeper technical stack so that you can see more applications. I want to see a marketplace for healthcare the same way you have the Slack marketplace, the same way you have the AWS marketplace, et cetera, et cetera. I think that's when you know that healthcare is in a really good place where there's actual competition and where the best kinds of products are winning because they answer the needs of payers and providers and patients.
Totally. Nikita, anything else you want to leave us with in terms of where you're excited to be investing in healthcare more broadly in that we haven't yet discussed or fully touched upon?
Yeah, I think, what I was alluding to before, I think taking just business applications that exist outside of healthcare, rejiggering them for the healthcare world and applying it. I would love to see an actual Google for healthcare. I would love to see a YouTube for healthcare that surgeons and healthcare providers can use. I'd love to see a Trello for healthcare, a Slack for healthcare, you name it. I think a lot of these things can be applied to the healthcare world. And I haven't seen too many of them, but there's certainly an opportunity there. Another thing I'd like to see is a really great UI path for healthcare, an RPA tool. We're seeing a couple of companies in the space, not nearly as many as I would like to see for the number of use cases that exist. And I think that, moving on to another kind of area to look at, of course, home health is huge and only becoming huger as we see the fragility of hospitals. And a lot of them are looking to more outpatient-like home health opportunities because it is, again, another expansion of revenue while allowing the hospital to be cleared up and taking more patients there. So there's a whole bunch of companies that I think could be built in the home health space. Like Honor is an example of something that's on the caregiver side. What if we actually apply the Honor model to many different areas of healthcare? I think that would be really interesting. Ones that have a lot of clinical and caregiving staff, but are not necessarily related to seniors. You can see this in the disability space. There's a whole host of clinicians and providers and just caregivers for patients like that and for their families. So I think that could be an interesting angle that we've been thinking about. I think another area is looking into certain interesting aspects of Medicare and seeing how we could build a business around this niche-y thing. So there's an example in the Medicare world called PACE. PACE stands for Programs of All-Inclusive Care for the Elderly. And it's really a catch-all, but what it's focusing on is how do you actually bring a whole host of community needs into providing Medicare? And there aren't that many companies being built in this space. There's like Commonwealth, which is a health plan. And I think that there's another company out in Pennsylvania and New Jersey that's building this. But I really haven't seen, just given how many dollars, like billions of dollars that are focused on PACE, I just haven't seen too many companies that do that. And I, was speaking to a friend at Flair that's also thinking about this space. And I think that they're spot on about this. End-to-end digital health is another thing I've been thinking about. I think it's great to draw on a lot of different tools. So this has nothing to do with tools, but more to do with digital health is mostly seen as an add-on, right? Like there's an aspect of the digital health side, and then as you need it, you can go in and visit a provider in person, et cetera. But there is this concept, I think, of there could be just an end-to-end digital health companies for certain areas. And I'd like to see, a couple of more companies thinking about it that way. And I think another interesting one I've been thinking about beyond just healthcare payments, which I think is still huge. There are a number of companies being built here. I think, Papaya Pay is an interesting one. There is no real fraud and risk analytics company that focused on healthcare. And I think you could take really interesting fraud and risk models from other industries. Like, let's say you've worked in the payment space. If you're a company like Stripe, if you're a company like PayPal, you are an expert in detecting fraud and risk on the KYC, AML, et cetera level. I think a lot of those similar concepts apply to healthcare and to claims data. And I would love to see a great company being built in that space. So those are just some of the things I've been thinking about. But if you're building in the healthcare space, I would love to have a conversation with you. I take, as many conversations as I can with folks in healthcare, from every single kind of actor, whether you're someone who's a patient or you're someone who's worked in the payer world or you've worked in a provider organization or a vendor or a startup. I think the more that we can share knowledge and information with each other, the better, and maybe build some great companies out of it. One of the things I'm focusing on right now, I'm writing a piece on how, and it's inspired by Lenny, who has this whole series for how consumer and B2B companies got their first customers. I'm trying to do the same thing in healthcare, and I got some time with some really, really great and known founders and co-founders in the healthcare world. But that's another thing that I've been thinking about deeply is like, how can we democratize a lot of these acquisition strategies beyond some of the things that Niko and I talked about, which is like almost the curse of the Rolodex, right? Like, can we actually make it so you can, beyond the technology side, which hopefully companies like Redox and Data Exchange are going to help enable, but can we give these multitudinous acquisition strategies to a bigger group of people so we hopefully see more healthcare companies down the line?
I love that. Are there any early learnings from the research so far?
I mean, I will say that people have such creative story. Like, just, I mean, it's not like they intended the stories to be creative, but building any company is hard. Imagine building healthcare companies and just the many, many different directions that some of these companies built in. Like, for example, some of these companies at the beginning, when they were just a project, even were not HIPAA compliant, but someone was using them to figure it out to see if this is something that we should actually build and turn into a real business. Companies that you would not expect to be having a large line of business, that, let's say it's a consumer health company, to have a large line of business in, the life sciences world. There are companies doing that, and it's actually like more core in some of their first customers versus consumer, which you may have expected. Or just stories about companies that started off a certain way and they had an anchor customer that was pulling them in all the wrong directions, right? And they had to adapt and change. It's going to be a really good post. I am excited. I've heard some like really crazy, honestly, stories, like stuff that I'm like, wow, I did not know that, or I would not have expected that for this healthcare company. And it's really nice. People have been willing to participate. I was worried that, I kind of put out this request and no one would be willing to chat about things. And, I get it's like, you can't give away all your secret sauce, but I think high level, there are a lot of things we could be doing to provide more strategies, more knowledge, et cetera. And I hope that this series is a small part of that.
That's awesome. Well,
yeah.
That's a great place to wrap. My guests today have been Niko and Nikita. Thank you so much for coming on the podcast.
Thanks, Erik.
If you're an early stage entrepreneur, we'd love to hear from you. Check us out at villageglobal.vc.